I'm Brian Nyquist. I'm the Infusion Access Foundation's founder and volunteer board treasurer. I'm also the president and CEO of the National Infusion Center Association. Quickly realized when I came on board with the National Infusion Center Association that we really needed two dedicated separate voices, one for infusion centers and the other for consumers and the people that really needed these types of medications. I was involved in a serious car accident, had to get a bunch of healthcare myself, and realized just how complicated the system was, how difficult it was to get the right care at the right time. In 2020 fall, we spun off the Infusion Access Foundation, formed a dedicated brand and diverse community and voice for the people that rely on provider-administered medications to manage the physical, emotional, and financial burdens of chronic disease. There is no one place that patients could go as it relates to infusion medications. The Infusion Access Foundation really wanted to create a hub where we could form these connections within communities and across communities through the lens of infusion access. So it really comes down to coverage, affordability, and access to care. So there are a lot of barriers that fall into each of those three pillars. First of all, making sure that there's adequate coverage, that people understand what they need to look for in a benefit plan design to ensure they then have the affordability component so they can afford access to the right medications. And then finally understanding where they can get that medication and overcoming some of the insurance hurdles to accessing that medication. So I've dedicated my career to helping people, and I'm getting an incredible amount of fulfillment from the Infusion Access Foundation and just the impact that we're able to make in people's lives. People are able to form deep connections, not only with others that share the same disease state, but with others in other disease states as well, tying together with that common thread that is infusion access.